At this point in the procedure, you've identified your insertion spot with ultrasound and you've put on your gown. Next, sterilize your spot with the chlorhexidine swabs that are included in the kit, swabbing in circular motions from inside to out. Now you're ready to open your sterile gloves and put them on.
Actually, it's not that. It's pretty close up. It's not terribly. You can even see the clavicle.
Yeah. I think this is good.
Yeah, I think this is a good, definitely good height. Then drape. Now
Take
hold
the
it
sterile
with
drape
you can see,
and using the directions on the drape, unfold it appropriately over the patient.
and then point that
You can fold it in
towards
half
you
like
can see
this to help approximate where you will place the opening on the
Okay.
patient.
Oh, that's good. Alright,
Unfold the drape as
Captures in my
such.
shot.
good. Look up slightly. That's okay. It's okay that the probe's there because you'll ask a friend.
An unsterile assistant can grab the lower edge and pull the drape over the rest of the patient's body. Remove the blue covering of the drape, revealing your insertion site.
So,
Next, you'll prepare the sterile cover for your ultrasound probe.
So this part, we do it really slow. Just 'cause
Uncover the packet,
the bag
revealing the
part is
gel,
kind of tricky.
the rubber bands. Set these rubber bands aside. Be careful
Do not
not to
discard.
discard them. Find the opening of the cover and place your non-dominant hand inside.
So,
From the other end, push your dominant hand through.
either way.
Mm-hmm. There we go.
Hold on, there
Yep.
you go. Yeah.
With this hand, you will grab the ultrasound. Your
little rods, you can
unsterile
see the
assistant should have
probe
placed
and how she's
gel on
handling it.
top of the probe. Then, with your
Yeah.
non-dominant hand, pull the edge over the entire probe, making sure to cover the cord. Again, your non-sterile assistant can grab the lower edge to pull the
That's good.
cover down. Smooth the probe, making sure there are no air bubbles. Pick up your rubber bands and secure around the probe.
This means that you need to get real close for this, though.
Mm-hmm.
There. Yeah.
Next, you can set up
Okay,
your
so
tray.
Now I'm going to sterilely drop the caps in.
Mm-hmm.
Have your unsterile assistant drop 3 caps into the tray. Take the caps and attach each one to the port ends, leaving the brown port without a cap. Next, remove the sterile flushes and flush each port in order to remove any air.
Yeah. Good. Okay, good.
To flush the brown port, you can take
And
the
then just
third
point out
cap
that you're-
and attach it
the-
to the
the
flush before
brown
you
one's gonna
flush the
stay
last
open.
port.
Just like lift it up and show them.
Just remember to keep the brown port without the cap on.
Yeah, that's good.
Next, check your
Do the
guide
wire
wire.
fingers.
Just yeah,
Yeah.
do the little check.
Remove the small cap and make sure the guide wire moves freely within the sheath.
Good.
Here is your
See, it's
lidocaine
good.
that you will use to provide topical
yeah, the view is actually
analgesia.
really good. The lighting is good, no shadow.
drop your lidocaine like this. And when you're done, remove the blunt tip needle.
Okay.
Insert the needle onto the syringe that is now filled with your anesthetic. Apply a small amount of the sterile ultrasound gel onto the site. Using your probe, search for the internal jugular vein. Infiltrate the skin with the 1% Lido around the needle insertion site. And insert the needle under your probe and find your tip.
It doesn't look like.
Aspirate to ensure you are not within a vessel, and then proceed to inject your anesthetic.
Try to inject? You're injecting?
Yeah.
Yeah, you're not gonna see it. That's okay. Okay, so you've anesthetized. Look down a little bit more. Ross? Yeah, okay. So,
Retract your needle after use.
Oh, did I flick you?
no, it's good.
Pick up the steel introducer needle attached to your syringe. It's advised to remove the steel tip needle and reattach it again, as it may be difficult to remove later on otherwise. Enter the skin with your needle while holding negative pressure. Simultaneously visualize the needle tip on your ultrasound screen as it advances towards your jugular vein until it is seen perfectly within the center of the lumen of the vein. When this happens, you should have a sudden release of negative pressure as blood is aspirated into the syringe. Once you have return of venous blood, stop advancing the needle immediately. Set your ultrasound probe down and firmly grab the needle with one hand while anchoring it down against the patient. With the other hand, take off the syringe. Grab the guide wire and thread the wire into the introducer needle hub. The wire should feed into the vessel smoothly and without any resistance. If you feel resistance, you should stop. Notice you will see on the wire that there are black lines that indicate the depth of the guide wire. You can feed to a depth of approximately 20 centimeters, which is marked by 2 black lines.
Get closer, closer. Actually, it's really good. Yeah, I can see 3 there. Okay, good.
Pick your probe back up to confirm the correct placement of the guide wire within the lumen of the target vessel. Use one hand to firmly hold onto the guide wire while using the other hand to carefully remove the introducer needle. It's important to never let go of the wire at any point until it is completely out of the patient. Set the needle down and grab the end of the wire in one hand while loading the dilator onto the wire with the other hand. Grab your scalpel and place a nick onto the skin at the insertion point, just large enough to accommodate the dilator.
Get real close. Sorry, Roz.
No, that's good.
Super close.
Look
Good,
at this,
good,
right?
good.
You can manipulate the wire up and down to ensure a clean cut. Insert the dilator over the guide wire with a steady twisting force at the proximal end in order to prevent kinking of the wire. Once you've reached an adequate depth, you can then remove the dilator while still leaving the guide wire in place. Insert your triple lumen central line over the guide wire. Advance until you see the distal end of the guide wire emerge from the middle or round port. You may have to feed wire outwards until it appears there. You should grab this tip and continue to advance your central line until an adequate depth is achieved.
Towards the camera lens.
Put your
This
hand
end.
towards
Put
the
your hand towards the
Oh,
camera
oh,
lens.
okay. Like this?
Sorry, yeah.
Okay.
There you go. Yeah, good.
For right internal jugular vein, this is typically 16 to 18 centimeters depth. Use the markings on the central line to tell the depth. The two bold dash indicates 20 centimeters with 1 centimeter increments marked by the single dash. Once the catheter is advanced to the correct depth, pull the guide wire out of the patient completely. This is a very important step to take mental note of. Grab the flush with the loaded cap and aspirate blood into the brown port to ensure correct placement in the vessel. Then proceed to flush the line. Clamp the line and repeat for the other two ports.
What's happening?
I don't know. It's a return.
Oh no, we have to show return.
It happened with grandmother flush.
This is fun. I haven't done a central line in a while. Give me return. Oh, it's just like, oh, it's very light.
Very
It's
light.
very light.
Look close, look close. Or get closer, maybe?
It's so it's
It's so blue.
it's just very faint.
Okay.
Yeah.
It's okay, we can see blue. We
Yeah.
can see blue. Okay.
It is the lightest of blue.
Try the brown port again.
This one is also just
So light.
so light. Yeah, the background is blue.
Yeah, we can't really change blue
Yeah.
because the red is for arterial.
Yeah.
Okay. Get it on the white background maybe.
On the white background. Some air too. It's kind of, yeah. Maybe because, yeah, it's very hard to see it in there.
That's okay. We're going through the motions. The
Yeah.
idea is that there's blood return. Okay. I mean, that could be the next edit if we want to do it again to just like make sure that the coat.
These last steps are about securing your central line onto the patient. This is done by suturing the line in place. First, take this white attachment and snap it over the insertion point. Over that, you can place the blue attachment. Just make sure the two holes on the wings line up perfectly. Each kit should come with a suture and a needle driver. Use these to secure the central line in place as such. Just be careful not to stick yourself. You can first guide the needle through the hole on one wing and then grab the adjacent skin with your needle. Make a simple interrupted stitch to lock the one side in place.
Is this close enough?
Yeah.
A little, could be better.
No, it's good. It's good. I mean, it's.
Simply repeat on the other side.
I mean, I'm not straining to see what you're doing. You know, it's just not like super detailed, but I think that's okay.
Yeah. Maybe
I
it'll
think
be
if the
different
point
on a
is-
computer. Maybe when we see it on the computer.
Yeah, on the computer you can blow it up, but I think
Yeah.
the point is
Although not shown here, this other attachment should also be sutured down onto the patient and can be done so that the catheter loops around away from the patient's head. And that's essentially the complete procedure. Just finish it off by applying the Biopatch and then removing your drape.
Do you think there's a way to make this video look down a little more?
Don't forget to order your confirmation chest x-ray and then write your procedure note.
Like just like how we do with the steps in this, like make it like a DVD where you can fast forward to like draping,
Like links or
ultrasound.
something?
Not really so much links, but like when you're going through a video and you're like, okay, I want to watch the first part of setting up the kit, etc., and finding my landmarks like at my desk. But then in real time, I want to
Nice work.
actual steps. I want to fast forward to that.